Next, we're going to talk about hand washing. So aseptic hand washing is very important. Like stated before, it is more than just a general basic hand wash. So the techs will wash their forearms and hands using an appropriate antimicrobial agent, following a specific sequence. After you've donned your mask, you do not need to sanitize your hands because at this point you will be doing your hand washing. Now, with the aseptic hand washing, you have to pay special attention to areas that may have multiple microorganisms. So that includes underneath your fingernails and in the creases of the skin. And one of those areas is around the inner part of your wrist. And a lot of people kind of overlook that. But also in between your fingers is another area that we need to make sure that we're cleaning properly. Learning this process is critical because, like I've stated before, most of our contamination is touch contamination. So the proper sequence, the following situations for completing hand washing. So when do you need to wash your hands? Because there are occasions when you can just use your IPA foam sanitizer. So when you need to wash it is when you first come into the sterile compounding area. So basically when you're starting your shift or anytime you re-enter. So if you've taken a break, if you've gone to the restroom, if you've had lunch, or if you've just gone out and maybe helped put away an order that's come in from your wholesaler, or you've run something to the floor. So if you sneeze or cough, then you should have proper hand washing. After a major contamination. So if you have a needle stick, if you're bleeding, or if you've cut yourself when opening an ampule, you'll have to go back and complete a aseptic hand washing. Or if you've had a spill that's greater than 5 milliliters. So we'll look at what a 5 milliliter spill looks like so we can put that in perspective. Also, after the hand touches any item that's obviously contaminated. If you pick something up off the floor, if you touch the garbage or remove a garbage bag, if you touch the sharps container or move a sharps container, or if your hands are dirty. So the hand cleanser, there's different types of hand cleansers, so identifying which one is appropriate for compounding is important. Now, it's also important because of the antimicrobial component that facilities change their hand cleanser on occasion so that we don't get resistance. So we want to have a variety of different things so we don't have that resistance. So some of the different kinds of hand cleansers that are available: chloroxanol is effective. It's common agent that we use for aseptic hand washing. Chlorhexidine gluconate is also an appropriate cleansing agent, so we can interchange those. Isopropyl alcohol, either in rinses, gels, or foams, are usually used prior to donning or in between to sanitize. If we have some minor contaminations, such as touching pens or calculators, or putting the label onto an IV bag, or if we have to adjust our eyeglasses, we would want to sanitize in between. Iodophores, which include povidone iodine, they're antimicrobial properties, but they irritate the skin. So most often, these are used topically if there's nothing else available. Triclosan is used in household soaps, but it's not appropriate in the pharmacy for aseptic hand washing. It's okay for just a general hand wash, basic hand wash. Now, there is some things, a lot of today you see advertisement of reducing the use of triclosan in many of these products. So in some situations, you have to clean your hands or your sterile gloves with foamed IPA. Upon entering the anteroom, prior to donning your PPE, you can use that foam after using a calculator or pen, as I stated before. If you have a spill less than 5 milliliters, and when there's potential for minor hand contamination, as stated on the previous slide. All right, questions. This type of hand cleanser is appropriate for general hand washing, but not acceptable for aseptic hand washing. And that would be triclosan. All right. A hand washing procedure that is more stringent than basic hand washing is called this. That would be aseptic hand washing. All right, now some additional questions. Once you've completed your hand washing, you will then don your sterile gown and your gloves. So those are the last two items. The purpose of having the gown and the gloves is to contain any kind of skin contaminants. So basically, we shed skin cells, about 1 million cells every hour. And these cells can have microorganisms on them, which can contaminate sterile products and compromise our patients in the hospital. So an IV tech who has aseptically cleansed their hands, they place inside of sterile gloves to compensate for two possible scenarios. Because you think, okay, well, I washed my hands. Why do I need gloves? If there's different things that could happen, like if the glove is ripped or punctured by needle or glass shards, or the growth of microorganisms on poorly cleansed hands that get enclosed in a warm, moist environment, great for bacteria to reproduce. Now, these microorganisms can actually come through gloves. Gloves have what are called micropores, so little tiny, tiny, tiny holes in the plastic. And then the other thing is we need to also be aware of that. Not only could we, if we didn't properly wash our hands, that a contaminated hand could have something seep through the micropores and contaminate our product, but if we spill things on our gloves, that they could seep into and be absorbed into our skin. So we layer attire so that it's appropriate for the warmth level, for comfort, and for practicality. We, of course, should have clean scrub uniforms on. We need to use sterile, lint-free disposable gowns or a gown that has been freshly laundered and sterilized by the hospital's laundry department. So there's certain criteria for those types of gowns. In most facilities, we will use a disposable gown. It should completely cover the front of the technician, have a secure neck closure or a tie in the back, and fit snugly around the wrists so that none of our potentially contaminant skin cells or improper hand washing could expose out to the patient. So we want to completely contain. Now, the comfort layer is important. Most of your IV rooms have to be at least 68 degrees or lower. So they're a little chilly. But once you start donning these layers with the gloves and the gown over your scrubs, and it doesn't have as much breathability, it can get kind of warm in there. So you want it to be a little on the cool side once you start putting those layers on. The technician should use ideally sterile, but definitely powder-free gloves. They should be synthetic, non-latex for people who are available or who have a sensitivity to latex. So if you have a latex allergy, it's very important that you let the appropriate supervisor know so that they have the right product on hand for you. People who are sensitive to latex, they may have an underglove that you can put on, but the gloves have to be powder-free. Again, powder could contaminate the work environment. Sterile is the best practice, and as I stated before, we'll learn how to don sterile gloves properly, but we'll also learn how to properly sanitize a non-sterile glove. As a general rule, the size 6 gloves are small, 7s are mediums, 8s are large. They should be close fitting and allow you dexterity so you can move your fingers around, not so tight that they cut off your circulation or cause discomfort. Gloves are meant one-time use. Now, that doesn't mean we change them every single item we make. That means that when we leave the compounding area and come back into the compounding area, we generally would change our gloves. And that would be the micropores.